Here in this anatomy model, we can see spinal cord here, and you can see spinal nerves coming out from these intervertebral foramina, and they join together and form the lumbar plexus here on the either side of the lumbar vertebra, and they also join together to form sacral plexus here inside the pelvis. Here is the sacral plexus. It is made up of the anterior rami of the L4, L5, S1, S2, S3, S4. L4 to S4, 4, 4. So L4 and L5 join together and make lumbosacral trunk. Here is the lumbosacral trunk from L4 and L5. And then lumbosacral trunk join to S1, S2, S3, and S4, and they make this big, large, important nerve, which is called sciatic nerve. It passes through the greater sciatic foramen and goes to the gluteal surface. Here is the gluteal region, and I'll show you again. Here is the inside the pelvis, and you can see lumbosacral trunk and S1, S2, S3, S4, and they join together and make sciatic nerve. It passes through the greater sciatic foramen and goes to the gluteal region. It comes out below the piriformis. Here is a piriformis muscle, comes out below the piriformis, and it runs all the way down posterior, in the posterior region or posterior compartment of the thigh. And here, at the beginning of the popliteal fossa, it splits into two branches. Here is the tibial nerve, and on the lateral side, here is the common fibular nerve. Tibial nerve, here's the tibial nerve, goes down to the ankle joint, and here is the common fibular nerve, goes through the fibular side. So, sciatic nerve, it gives off some branches here for the hamstring muscles. We had some hamstring muscles I showed you before on the medial side. Which muscles we had? Here's the medial side, is semitendinosus and semimembranosus, and on the lateral side, is this here? On the lateral side, we have biceps femoris. So, if I put the hamstring, put them their place, and you cannot see the sciatic nerve. If I put the gluteus maximus, again you cannot see. So gluteus maximus and hamstring muscles completely cover the sciatic nerve. So if I take them away, you can see the sciatic nerve. If you want to find the exact place of the sciatic nerve in this area, you should palpate these 2 points, bony landmarks. Here is the hamstring origin, it's the ischial tuberosity. Here is the greater trochanter. The point between these 2 landmarks, we have sciatic nerve. It goes down deep to these muscles and innervates these muscles. So the tibial branch of the sciatic nerve innervates the hamstring muscles, semitendinosus, semimembranosus, and adductor magnus, hamstring part of adductor magnus, and long head of the triceps. These 4 muscles, 4 hamstring muscles, innervates by the tibial branch of the sciatic nerve. And then it goes down and crosses this popliteal fossa, and it innervates all muscles of the posterior compartment of the leg. I mean all superficial layer and deep layer. As I showed you, here we have superficial layer, gastrocnemius, ancilius, plantaris, all 3 superficial layer muscles, and all 4 muscles, popliteus and flexor digitorum longus, yes, flexor hallucis longus and tibialis posterior. All superficial and deep layer muscles again innervates by this, are innervated by tibial nerve. Then tibial nerve, I'll show you here. It passes behind the medial malleolus in the tarsal tunnel, deep to the flexor retinaculum. Here you can see, here is the medial malleolus, here is the calcaneus, here is the flexor retinaculum, and here is deep to the flexor retinaculum is the tarsal tunnel. And this yellow one is tibial nerve I showed you. So tibial nerve passes through this tarsal tunnel, and after passing the tarsal tunnel, it splits into two branches. You see here, like arteries, it splits into two branches, medial plantar and lateral plantar. Here is the big toe, so this one is the medial plantar, this one is the lateral plantar. And medial and lateral plantar branches of the tibial nerve innervates all intrinsic muscles of the plantar surface of the foot, like the artery. What about the common fibular nerve? Here is the common fibular nerve, sciatic nerve, tibial nerve, and common fibular nerve. Common fibular nerve, you see here, it passes on the lateral side of the popliteal fossa. It winds around the neck of the fibula. Here is the neck of the fibula. Maybe it compressed against the neck of the fibula. And then it gives off two branches. One of them is superficial branch. You see the superficial branch. It innervates the lateral compartment muscles. And then you see the deep femoral fibular branches. It innervates the anterior compartment muscles. So as a quick recap, anterior compartment muscles are innervated by the deep fibular nerve. Lateral compartment muscles of the leg are innervated by the superficial fibular nerve, and all posterior compartment muscles are innervated by the tibial nerve. So you see here we have anterior compartment muscles. Which muscles we have here? We have four muscles I showed you in the last video. Here's the tibialis anterior, extensor digitorum, extensor, here is the extensor digitorum. Deep to the extensor digitorum we have extensor hallucis longus and fibularis tertius. All these muscles, anterior compartment muscles, are innervated by the deep fibular nerve. And on the lateral side we have just two muscles, fibularis longus and fibularis brevis. These two muscles are innervated by the superficial branch of the common fibular or superficial fibular. You see here is the superficial fibular, here is the deep fibular nerve. And you know, in addition to innervating the muscles, they provide sensory innervation for the skins. As you see here is the superficial fibular. It innervates the skin on the dorsum of the foot. You see, these two branches are the branches of the superficial fibular. It innervates the skin over the dorsum of the foot, except this space, the space between the big toe and second toe. This innervates by the sensory fiber of the deep peroneal, surprisingly deep peroneal nerve. You see here, it crosses, it innervates the anterior compartment muscle and goes down with dorsal pedis artery, and it pierces the deep fascia here and supplies sensory innervation for the skin on the big toe and the second toe. Other part of the skin of the dorsum of the foot innervates by the superficial fibular nerve. The last important thing is that this common fibular nerve prior to dividing into two branches, superficial and deep, it gives off a branch for the short head of the biceps. You see, the long head of the biceps is the hamstring muscle. It is innervated by the tibial nerve, but the short head is not hamstring muscle. It is innervated by the common fibular nerve. So common fibular nerve also gives off a sensory branch which is called lateral sural nerve. It innervates here, the lateral, superior lateral part of the leg. It is called lateral sural nerve. So it also gives off one sural communicating branch. It joins to the sural branch from the tibial nerve. So we have sural branch from tibial nerve. Here is the tibial nerve, and sural communicating branch from the common fibular nerve. They join together and make sural nerve. They innervate the skin over the back of the leg and skin on the lateral side of the foot here. Sural nerve innervates here, lateral side. Saphenous nerve from the femoral innervates medial border of the foot. Saphenous, medial border of the foot. Sural, lateral border of the foot. Dorsum of the foot. Most of the dorsum of the foot is skin over the dorsum of the foot, mostly innervated by superficial fibular. Just here is innervated by deep fibular. What about the plantar surface? Plantar surface, it's innervated. The skin over the plantar surface is innervated by the medial and lateral plantar branch I showed you here. The tibial nerve gives off two branches, medial and lateral plantar. In addition to innervating all intrinsic muscles, they supply sensory innervation for the skin over the plantar surface. And the tibial nerve also gives off a calcaneal branch for the skin over the calcaneal part. Here is the skin over the calcaneus, innervated by the calcaneal branch of the tibia. Yeah. So, as a quick recap, I want to show you the common fibular and tibial nerve. Common fibular gives off three branches. One of them is motor for the short head of the biceps. Two sensory branches. One of them is lateral sural for the lateral surface, skin over the lateral surface, and sural communicating for the sural nerve of the tibial, the medial sural and the medial sural nerve for the lateral border of the